Hello, and welcome to another edition of Patient Preferred Presents. I'm your host, Melissa Castellano, and today I have the pleasure of introducing you to patient preferred physician, Dr. Sharona Ross, an advanced Foregut and HPB surgeon who's been awarded the 2023 Empowered Women in Medicine Award by the esteemed Patient Preferred Physicians Network. With over 20 years of experience, Dr. Ross is recognized for her leadership, excellence in patient care, and inspirational attitude towards healthcare. She specializes in robotic and single-incision laparoscopic operations, focusing on conditions of the esophagus, stomach, small bowel, pancreas, gallbladder, and liver. Dr. Ross goes beyond her surgical work by organizing the annual International Women in Surgery Career Symposium, promoting interaction and idea exchange amongst women within her field. She is actively involved in various medical organizations and affiliations. So without further ado, I'm excited for us to meet Dr. Ross. Start by saying congratulations. You are the recipient of the Empowered Women in Medicine Award this year. And for our audience, I just want to let them know what that means. So that means that the Empowered Women in Medicine Award is given to a select group of physicians who have demonstrated leadership within their field, and they are true beacons and inspiration and thought leaders. So judging by your work history, doctor, I can certainly see why. So if we get started, let's go ahead and start talking about your Women in Surgery Symposium. That's the yearly event that you host every year for inspiring women surgeons. Tell us a little bit about the symposium and why this event is so important to you.
Well, the symposium started back in 2009 when I realized in my own office that we started to have a few more women students, medical students. And so I made it into my cause, my goal to try to change the perception, the negative perception. And so the first event was in my living room where I brought with friends, brought students from all around the area in the Tampa Bay area to talk about that among women fellows, residents, and attending surgeons. And let me tell you, I had within a few weeks almost 200 students in the house, and they were so fascinated. They had so many questions. They were really surprised that it was the way it was. I mean, they had no idea. And since then, we felt that if the need in the Tampa Bay area is so high, it must be the same all over the country. And the next year, it was a national and international event where we had women from 25 to 30 states coming and joining together. And since then, I was hoping that over the years, we won't need it anymore because we're going to reach the point where there's a critical mass of women surgeons. But it grew bigger and bigger, and now we're celebrating the 14th year, where it's truly going to be a global celebration. We're going to bring women from Europe, from Africa, from the Middle East, from Asia, all together with us to talk about successes and what each of us did to be successful despite working in still a male-dominated field. And I think that it's still important. Women should always support one another and really bring each other up. And that's the whole purpose of this event, is bring women together for networking purposes, but also bring the younger generation together with the more successful women surgeons so they can get a really true information of how it is today, not the way it was before, but how is it today? And then they can make a more informed decision regarding their career and their future.
Wow, so very empowering, starting in your living room to what it is today, what that must feel for you inside too, that you still get to create this message and it's still going strong after all these years. So such an inspiration to all. So with that, doctor, you've been leading the way in surgery, both by educating others and in practice. So can you tell us when you first began incorporating more robotics for more complex operations?
Sure. my goal during my training is to minimize trauma during operations, to make it the most minimally invasive. So I did two fellowship. One is minimally invasive HPB fellowship, and then another in endoscopy with gastroenterologists to do everything through scopes, through inside the mouth or the colon, and with the idea of how can we minimize the scar, minimize the trauma to the patient while doing the same operations. And so back in 2007 or so, we started single incision laparoscopy, and in 2012 converted everything to robotics, to multi-trocar complex robotic operations with surgeries of the esophagus, stomach, pancreas, duodenum, and gallbladder. So anything from anti-reflux operation to esophageal cancer, stomach cancer, pancreatic cancer, duodenal cancer, cholangiocarcinoma, gallbladder cancer, all of those done robotically.
Robotically. Wow.
So
And
once again, it minimizes the trauma. Patients recover better, quicker. They do overall pain is better. They feel stronger, and if they need chemotherapy, they get to treatment a lot sooner.
yeah, yeah. Very good. So with that, doctor, you just said you specialize in single incision laparoscopy and robotic surgery for the foregut, the upper GI, and the HPB, like you had just mentioned. How has technology played a role in your clinical decision making?
Oh, technology goes hand in hand with surgery, in my opinion, because that's what allows us to continue to progress. And it's the same operation, but the methods, the approach is always different when you embrace technology. So I think that using technology, and I embrace it, the good one, because there's a whole array of technology that coming by to the operating room, but I really try to be very particular in what I choose. And what I choose is what I think has the better results. And then I follow up by looking at my patient's outcomes. And so I believe that surgeons that constantly looking to grow and change, they have to embrace technology because that's what allows you to make everything better. And so I think that the future is with robotic surgery and all the different technologies that come with it.
Yes. So it was going to be a later question, but this leads into it. With AI on the rise in every industry, let's go right into it. How is artificial intelligence important in surgery today?
Oh, it will be amazing, in my opinion. And what do I
Mhm.
mean by that? It's
Yeah.
going to take some time because when you look, let's talk first about training of residents and fellows, or even younger generation surgeons versus having the robot help really well-trained surgeons to do moves that are more precise to the best outcomes. And let me explain that. So
Yeah.
from training of the care of the patient received after surgery. So you can look at the outcomes and you can then find for the surgeons who did those operations, the robot can study the way they do the operation, right?
Hmm.
And then young surgeons sit and try to learn how to do a specific operation. The computer can teach them how to do it by an expert move. In other words, an operator, the computer can say, "Oh, I would suggest to do X or Y, or an expert move would be this one or that one." So in other words, you're not only training the younger generation what will be the experts' moves, but you also standardize the care, the quality of care of all the surgeons, by all the surgeons to all the people around the world, because the robot can teach you that. So still, it's not that the robot is doing it, the
Hmm.
surgeon is doing it, but the robot can add information of how an expert would handle specific situation.
Hmm.
For that to happen, you have to have a humongous amount of data collected in order to develop the algorithm, machine learning, and then have that. Also, looking now much more into the future, in order for the robot to really do the operation, I'm sure that that would just a matter of time. you all depends on the data that is put into it. And so I think the future is really exciting,
Yeah.
because it will allow us to deliver the best care we can to patients, working with engineers, working with industry. This will take a long time or a
Yeah.
much shorter. Even industry talking to each other, I think would expedite the outcome. And so it's exciting. I know that artificial intelligence kind of people kind of worry about it, but if we embrace it and really study it and bring out what really would be useful to most people, I think that's where the benefit is. We have to be careful, but at the same time, the potential is truly amazing.
Yeah, and certainly fascinating. And I have to say, too, it probably provides a confidence level for the physicians, but also for the patient as well. So,
Correct.
it looking forward to, what the future holds for that for sure. So just going back,
I would add to that, I would add for just a second, telesurgery, which is a whole new other venue that we're looking into. That means I can operate here on a patient that is in Japan or China or Europe or anywhere else that doesn't have the same level of expertise. We can assist another surgeon that is operating locally from here in the United States and vice versa. I mean,
yeah.
so telesurgery, telehealth that we all are familiar with is actually sitting here and controlling the instrument in a patient that is miles and miles away. I mean, it's truly incredible, and that will become possible. In fact, it's possible now. It's just that
Okay.
now, in order to make it more global, you have
Okay.
to work on all the different details that are required.
Well, talk about fascinating. That one is certainly, like you said, the reach to those who don't have this technology or don't have that level of expertise. So that's definitely something, to look forward to, coming. Like you said, it's available now, but it's just not that popular yet. So looking forward to that. So as professor of surgery, master surgeon, and the director of the Advanced GI and HPB Fellowship, we see that you have an extensive history of training other surgeons on the latest technologies. Can you tell us more about this endeavor?
Sure. So when we did started back in 2008 with single incision laparoscopy, we went my partners and I and really trained many surgeons how to do single incision laparoscopy. Now we're talking about robotic multi-trocar, multi-port robotics, complex operations for pancreatic cancer, esophageal cancer, stomach cancer, and such. So we proctor all around the country surgeons that wants and are interested to learn how to do those operations robotically. I'm
Mhm.
about to start a pilot study regarding single port robot. So through a single port robot, converting all those complex operations to just one small incision with the robot. So all
Mhm.
the precision, the increased visualization, the stable platform now is not going to be done with laparoscopy, which remember, it's not a stable platform. You require many hands. With the robot, it's a stable platform that provides you 3D visualization. You can have a wrist motion, and everything is stable. I sit in one a console and move four different trocars, including the camera. It's a whole different game ball, and it's truly amazing. So I'm looking forward to that study to really move everything from multiple incisions to just one single incision, small incision.
And as a patient, and just knowing through sadly some experiences with the family or friends, these are operations that are more complex and have not really had much hope or for the patient. If you have esophagus cancer or going in, but something using technology or robotics offers more of that hope and faith, to be able to go in where before 2008, like you said, you might not have been able to. So,
Well, you would do the same operations, but with big incisions. Big
yeah.
incision in the abdomen, big incision in the chest for esophageal cancer. Now you don't even have, like when I take esophageal cancer out, I don't even enter into the chest. I do all small incisions currently, robotically and a small incision in the neck and take the entire, almost the entire, leave a little bit of esophagus here, taking the esophagus out through the abdomen and then bringing the stomach up into the neck where it's connected. And it's all with very small incisions. So patients do better and recover a lot sooner. But the visualization allows you to do a really nice dissection up in the mediastinum, collecting all the lymphatics, protecting the heart, protecting the lungs. I mean, it's great improvement to what used to be before, just open operations with just the arms up in the chest, and it was a lot to recover from.
Right.
Now it's much, much easier. Same thing with pancreatic cancer. It's the same in the same way. Big operations before. Now patients don't even go to the ICU. They go home within 3 to 5 days, survive longer because they can tolerate the chemotherapy much better, and they live a lot longer than before when we did open operations.
So more success rate and less risk for the patient as well. So definitely positives on that side. So doctor, some might say that this technology is hindering that patient-doctor relationship. Some are going to say that it's enhancing it. What are your beliefs on that topic?
I think that the relationship with the patient starts in clinic way before we take a patient to the operating room. In the operating room, patient is asleep. Who wouldn't want a more precise work, stable platform that operates on you? You know what I mean? That the minimal risk of bleeding and a better control. I mean, that has nothing to do with the relationship with the patient, because the relationship is before the operation and after the operation. And I think I stay with my patients even way after I take the cancer out, and I see them every time they have imaging with a oncologist. I always want to know how the patient's doing. And so the relationship, I think, is separate than the technology. The technology, I think, it depends on what the surgeons is conversing and explaining and educating the patients, but it's more protective for the patient. It's providing them better care, better outcomes, and better survival.
Yeah.
At least in our hands.
Right. Very good. So you've already mentioned too the future of technology being with, like we just said, you can operate from where you are on patients in other countries. Is there anything you want to add to the future of technology in surgery?
There's so much. There's so much new technology that allows you to be safer in the operating room during those operations, the robotic operations. There's technology that would help standardize, as I mentioned before, the quality of the care that is delivered in the operating room by all surgeons. In other words, it will be able to, the robot will teach them to provide the best standard of care. And like we mentioned, globally, technology would be able to provide the same quality of care everywhere else, even in those areas that can't afford it, but they'll have an outreach to get there and help them. There's also tele-mentoring where one surgeon can help teach another surgeon from a different location. There's efficiency in operating where you can flip rooms from one to another robotically, so you save time between cases. You're less wasting time where the surgeon just waits and waiting for the next case. So there's a lot of new technology that is going to come to make surgeons more efficient and with better outcomes for patients.
Well, we certainly look forward to seeing it, and, what you're doing is inspiring to all, and, as a patient, as physicians, and your training. So, doctor, it was very lovely speaking with you today, and we thank you for sharing your expertise, your knowledge, and your inspiration to our audience here. And we wish you even more success in this new year. So thank you so much for being here with us today.
It's truly a pleasure to be here.
Thank you for tuning in to another episode of Patient Preferred Presents. For more information about today's guest, Dr. Sharona Ross, please visit www.abbothealth.com. And to learn more about how to be a guest on our show, please visit www.patientpreferred.org.